I'm Dr. Neema Bhat, Senior Consultant Hematologist, Bone Marrow Transplant Physician, and Pediatric Oncologist. I'm talking about a very important topic that is cervical cancer awareness. January 2020-25, Cervical Cancer Awareness Month, and although I'm not an oncologist, I treat mostly blood disorders. But since I'm a female and I'm a clinician, I'm a physician, it's very important to talk about this topic because no matter how much we talk about it, I think there are a lot of gaps still to be plugged and there is a lot of awareness still to be spread about this disease. So, cervical cancer, what is it? It is cancer that develops in the cervix, which is a part of the female reproductive organ. What makes cervical cancer awareness so important? Number one, it is one of the few preventable cancers. So, being a blood cancer specialist, I get a lot of patients who come and ask me, why did this happen? And is there any way we can prevent it? So, one of the few cancers that we know why it happens, about 90% of the cervical cancers actually happen because of a viral infection called human papillomavirus or HPV infection. One of the very few preventable cancers is cervical cancers because it can actually be prevented by giving vaccine against this viral infection. So, being one of the most preventable cancers, another additional point also is it is one of the easily detectable cancers if women in the particular age group where screening is recommended go in for regular testing and screening. So, these two main points is what I'm going to touch upon, which is prevention and early detection. So, the HPV vaccine, it is mainly known as Gardasil vaccine. Actual vaccine that's available actually prevents to, as I said, almost 90% of infections related cervical cancer that is caused because of human papillomavirus. This Gardasil or HPV vaccine is now readily available in India for administration for females between the age of 11 to 12 years of age all the way until the age of around 35 to 40 years. But after the age of 35-40, it is difficult to give this vaccine or the use is not as much, especially if you have not received your first dose, at least in your early adulthood. So it's very important to be, whether you're pediatricians or physicians or gynecologists or obstetricians, no matter which part of healthcare you are in, or of course if you're a community member or a patient, then you have to freely discuss about cervical cancer vaccine with your healthcare provider. And it comes as 3 doses, this vaccine. It has to be given, first dose, and then second dose is a month following the first dose, and the third dose is 6 months following the first dose. So it's an easy enough schedule to follow, and it can prevent, as I said, almost up to 90% of cervical cancers. Now, what do we do as part of, what else can we do? Not just females, it is shown that even men in this particular age group, especially between the age of 13 to 15 up to the age of 40-45, people who are actively in the reproductive age group, men also take these vaccines, then the incidence of this HPV virus and in turn cervical cancer can be brought down significantly. If we compare the Indian data with the Western data, basically we're comparing middle income country, which is India, to a Western country, which can be the European Union or in the US. The incidence of cervical cancer has been significantly brought down from about 65% to only about 25% over the last 8 to 10 years. Previously, the incidence was as high as 65%, but with regular, planned vaccination and spreading awareness in the community, the incidence of cervical cancer has been brought down significantly. Now, the other thing that I wanted to speak about is early detection. So, if you are a female in the age group of anywhere between 21 to 65 years of age, you're ideally required to go for a FAAP screening test or a cervical cancer screening test at least once every 3 years. Now, there are stringent guidelines that say even if you do it once a year, it is not wrong, but at least once in every 3 years is what is recommended. And the gynecologist has to send off what is called a FAAP smear, which is basically a long cotton swab is taken and a cervical swab, a sample is taken, which is sent off for testing. Along with this, HPV testing also has to be done to see if the person is already infected with HPV virus. Depending on the type of HPV virus, different varieties are there. So which type of HPV virus, that person will have to be watched or screened more closely for prevalence of cervical cancer. As I said, between this age group of 21 to 65 is what is the recommended age group for testing. Beyond the age of 65, if at least more than 10 screening tests have been negative and the patient has had no complaints, then there is data to say that beyond the age of 65, the incidence or the finding of cervical cancer comes down significantly and we don't really have to go for regular testing. So after the age of 65, the testing can be reduced or stopped. If you have any further questions regarding cervical cancer, please feel free to contact us at Therrapie Hematology and Oncology Center. Thank you.